We're broadcasting from a very, very cloudy Johannesburg we are this morning, and as you can see on your screen right now, we're in Soweto. We're in the heart of Soweto this morning, and you can see those clouds hanging over us, threatening to burst and open up and drop all over us. But so far, they're not. So all is good here. We're at the Southwest Gauteng College in Malapo, Soweto. It's great being here this morning and seeing the enthusiasm amongst the students that have gathered here, that have come for all the different testing things that are here, whether it be for HIV testing, whether it come here to have a circumcision done, to get some free condoms, to actually find out about legal abortions. I've even seen a stand there about that. There's so much that is here that the department has brought to the students to make it much more convenient and easy for them. Now, this initiative has been around since about 2011, and it's managed to reach a lot of students around the country. Well, the man that's really been the driving force behind all of this is Dr. Ramneek Ahluwalia. He's the director of health here in South Africa, HIV/AIDS program for the higher education and training. It's good to have you on the program. Welcome to Morning Live.
Thanks, Leanne. Thank you very much.
So we say this has been around since 2011. What would you say? How many students have actually reached through this program?
Around 2 million young students, which are around 429 campuses countrywide. Across every municipality, every community, urban informal settlements, rural settlements. So anywhere you see a college or a university, every student gets access to this First Things First campaign of ours.
Which is wonderful, because at the end of the day, we're talking in this region, 2.7 million people aged between 15 and 24 are at high risk of becoming infected with HIV, and most are women. These are official statistics that we're talking about, so it makes sense being here. This is the age group we're focusing in on.
Absolutely. I mean, it's a nation where 6.4 million South Africans suffer from a disease called HIV. We are a nation where still 1,000 new cases come every day. And of course, the new population, that's where the new infection comes mostly, are the age group between 15 to 25. This is the age group where the sexual debut happens. This is the age group where they become the unbound freedom. Specifically in campuses, lots of alcohol and drugs is there, lots of unbound freedom, you change multiple partners, no condom uptake, and that makes them much more vulnerable. So of course, if we put our emphasis in this sector, if we stop these young people, I'm sure they have a very healthy life, and they are the next economy for our nation at the end of the day.
Now, as we speak right now, the minister is actually doing a procedure. He is doing a circumcision. In fact, I'm seeing the door opening, and it might actually have just come to an end. How many, maybe I'm again asking you all these numbers, but how many circumcisions have you done through this by going into the campuses?
I think we have touched close to 10,000 young people, and I think we want to achieve much more bigger targets. The desire is for the fact that, and that's why we are here. The First Things First stands for first priority of every South African to look after their health. And that's why we want to provide a comprehensive package. And that's what I requested the minister. Minister, let's do a comprehensive package. Let's do intradermal implants, because we've got teenage pregnancies. Teenage pregnancies, we've got highest maternal death. These girls do not finish their studies. Let's do MMCs. Let's save our men. Let's also start doing blood pressure, the NCD program, our cancer screening. Everything you can think on a basic health facility is being provided today for at the doorstep of the young person. You'll be surprised, Leanne, that today 17 other campuses in this country are also activating First Things First parallelly. Somewhere in Western Cape, somewhere in KZ, and somewhere in Eastern Cape. Today you are at the launch, but activation happens every day in some or the other campus, and some or the other young person is being protected through this initiative.
So this happens every day at some campus somewhere in the country. How many mobile units do you have?
I rely on the Department of Health mobile clinics. I rely on the US government NGOs. I rely on other NGOs and civil societies that support me. So we've got a consortium of 300 partners together in one room under the HEAIDS program. And 300 partners pledge with me on grounds of providing services across every district and municipality every day whenever the activation takes place in any campus of a college or a university.
Which is very heartening. Just give me a snapshot. I mean, today, you look around here today, there's a lot of students that have gathered here. But how many do you think are actually going to go through with the procedures that are here, whether it be the young girls that are here that are going to get, just remind me what you actually call it. It's something new I'm not too sure about. When you actually get the contraceptive put into your arm, that procedure, what is it called?
It's called an intradermal implant. implant or subdermal implant. It's basically a small thing that you put inside the skin, and this protects you for the next 3 years from contraception.
I imagine that is quite a big, and a lot of the ladies will do that. But the circumcisions, I still question. How many do you reckon today you will get to actually have a circumcision done?
Last time when I requested the minister to do it, we had 52 done on the same day. And you never know, we might reach the same numbers today itself. And I think these are 52 young lives that's going to be protected. And I'm sure we're going to be touching more than 100 family planning subdermal contraception. So probably another 100 girls will protect them from teenage pregnancies today. So it's enormous.
And that's what's important. Thank you. Keep up this amazing work. Dr. Ramneek Ahluwalia, who is a Director of Higher Education and Training HIV/AIDS program, talking to us about these mobile units that are at one campus at any given time around the country nationwide, which is a fantastic initiative. It really is.